start with the timer, and here is your question. Right. So if you have read and understood, considering it examination station, kindly begin.
I will enter the room. I will wash my hands. Hello, I'm Dr. Hamad, a surgical doctor. They have been asked to examine your neck. Are you okay with that? It will
Yes.
include feeling and also some movement.
Yes.
Okay, thank you. May I confirm your name and age, please?
I'm Tina, 32 years old.
Okay, nice to meet you, Gina. Can you sit down this chair for me?
Okay.
Can you lower down your gown for me, please?
Okay.
Okay, thank you. I will start by the description of the patient. I will comment on the general condition of the patient. If the patient is agitated or anxious. Then I will take a look and inspection to the lump. There is lump overlying the anterior neck swelling. It is overlying the submandibular gland area. It is about 4 by 3 centimeter oval in shape.
Yes.
And skin overlay is normal. There is no surgical scars, no dilated veins. And the other side looks normal. There is no swelling, no surgical scars, and no dilated vein as well. Can you open your mouth for me, please?
Yes.
Pick up your up. Okay. On examination, inspection of the worsening ducts, there is no signs of inflammation. There is no thickening, and also there is clear side, very clear saliva. And the other side also looks normal. Now I'm going to palpate you from behind. Are you okay with that?
Yes.
Okay, do you have any pain in your stomach?
No, not much.
Okay, I'll start by looking for any tenderness. Meanwhile, I would like to look at the eye of the patient. After that, I will compare the temperature. Also, I will palpate for the other side as well. Then I will see the edge. It's regular. It is not attached to the overlying skin, and the consistency is look firm, and there's not reducible, and there is no palpable pulsations, and there is no swell, and also then I would like to palpate for the lymph nodes, palpate for the submental, submandibular, preocular, postocular, and also superficial and cervical and supraclavicular. Now, can you stick out your tongue for me, please?
Yes.
Okay. Can you push your tongue to your cheek and try to resist my finger?
Okay.
Okay. Can you smile for me, please?
Yes.
Okay. Now I'm going to do the bimanual examinations. I will wear a gloves by the middle and the index finger, and
yes.
also the other hand. I will wait for any stone or anything. Also the other sides. There is no thickening, no stones. Okay. After that, I will to assess the lingual nerve. I will put a cotton in your can you feel this in your chest?
Yes.
Okay, just I will do the same in your tongue, and then close your eyes. Okay, I will assess lingual nerves, and after that I would like to complete my examinations by doing the transformation test and also auscultation. and also would like to assess the parotid gland and other salivary gland.
Okay, good. Can you summarize your examination now, please?
Okay, I have examined the 32 years old female who presents with the swelling on the side of the submandibular gland region. It's about 4 by 3 centimeter and oval in shape. There's no surgical scars, no dilated vein, and the other side is fixed normal. No swelling, also no surgical scars, no dilated vein as well. On palpations, there is no tenderness, and the temperature is normal compared to the side of the body. There is it's not reduced and is firm in consistency, also regular edge, and it is fixed, not mobile.
Okay. So what are your
Then
differential diagnosis for this patient?
For this patient, most likely it could be to CLUDCS or it could be due to neoplasm 9 or 9.
Okay. How would you confirm your diagnosis?
Taking historical examination or order some investigations like cielogram and also endoscopy.
Yes.
And also like to order ultrasound and CT or MRI. And also do
first
needle
X-ray.
aspiration.
Okay.
Yes.
What are the treatment options or alternatives that can be offered to the patient?
It can be conservative or surgery. Conservative is like analgesia and antibiotic, and also offer massage to the gland.
Good.
Surgical can like endoscopy.
Before surgery, you can also offer cyelogram. Yes.
Yes, it is therapeutic as well. And also surgical excision of the gland.
Very good. Okay, good. Right. Thank you.
Thank you.
Here is your question, please. Right, so if you have read and understood, considering the communication skills station, kindly begin.
Hello, I am Dr. Saidur Rahman, one of the surgical doctor in this hospital, and I am calling to Mr. Tom, on-call surgeon, regarding a patient who have a mastectomy done 2 days back, and he's developed axillary swelling and shortness of breath, and now his daughter want to take his mother without medical against discharge again medical advice. Can we check that I speak Mr. Tom?
Yeah, it is Mr. Tom. So please summarize your case.
Okay, sir. Elder lady, 78 or 70 years old, have mastectomy 2 days back, and axillary clearance done due to breast cancer. Now she developed swelling in the axillary region, and she has also developed shortness of breath, and she is known cases of COPD. And now his daughter is calm, and he want to take his mother to go home, and I will try to convince her daughter. Our convinced, and she want to go take her mother to go home.
So has the patient made his own decision, or he has been bullied into making the decision to go home?
I think her daughter convinced her mother, and now she want to go home with his daughter.
So what about the patient? Is he allowed in making decision?
Yes, I take the patient that she take an informed decision. Yes, she is competent to make a decision that he.
What do you think is the cause of bleeding in this patient?
Okay. It is second period, so there is a it is maybe due to second reactionary hemorrhage, and I also consider the DVD and because patient has COPD, so there is also chances of pulmonary embolism because we see that patient has shortness of breath.
So how are you going to manage this patient?
Good.
First of all, I ensured that it causes of reactionary hemorrhage. So I sent some blood, like full blood count, to check the hemoglobin level of the patient. And if the patient has also shortness of breath, so I should evaluate that it is a DVT or pulmonary embolism. So I also arranged some CT pulmonary angiogram and also some duplex sonography. And I will manage according to the cause.
So if there is a pulmonary embolism, then what will you give to the patient?
Okay. If it is a pulmonary embolism in diagnosis in CT, PA, then I will contact with the cardiologist and medicine, internal medicine,
Yes.
and give treatment according to the protocol.
Okay.
And
So what will you do if they were insisting to go home?
Sorry, I cannot.
So what will you do if the daughter has convinced her mother to go home? What do you do now?
Okay, I will inform her daughter and the patient also that we cannot discharge you medically, and if she want to take discharge, then she had to give some signature in some legal document, and I inform them that which complication may occur premature discharge, and I will also inform them some sign like that in the short of breath, increase the own discharge, or in patient feeling more unwell, then please to the nearest emergency hospital and or contact with our hospital. And I also inform the local GP and social worker.
Okay, thank you so much.
No. Okay, so can I summarize what we discussed? Okay. The old lady has a second post-operative of mastectomy with axillary glands of her breast cancer, and now she developed shortness of breath and swelling in the axillary region. But patient daughter want to take her mother in home against medical advice, and I advise her to sign all the legal documents, and I give some advice that what is complication may develop, and which sign is red mark, and when she need to attend the emergency department. And can also write some letter to GP and social worker.
Yes.
Okay.
And you will make them sign
Thank
the
you,
form
sir.
as well. Because it's discharged against
Okay,
medical
thank you.
advice.
Thank you, sir.
Right, thank you. We still have little time left. So what more could you have added? It's getting better, but
Maybe
then
some
my problem, when you are explaining, then you said second POD, so no abbreviations in explanation or in any exam. So second post-operative day. or SOB, shortness of breath. So I have written it, but then you want to, when you're explaining, you say the whole word, like complete, no abbreviations. So what else? If you have
And
listed,
also some patient need with drain or not, some question.
yes, and the drain was one question which was not asked you, which was not put forward for you, that if the patient has drain and how much fluid there is in the drain.
And drain with the patient and I GP
Yes.
regarding the drain.
So you'll send the patient home with the drain, right?
Yes, ma'am.
Yeah, and when would you, or when were the last labs done? So you have to look at the dates in exam. They'll ask you when the reports were done, lab reports, and then you have to make sure when they were done and when would you ask, or when would you do them again. So that you have to also mention. Right, and social services you have to arrange, because this doctor lives 20 minutes, like she lives 20 miles or something away from the mother. So you have to talk to the social services as well, so that they can go and they can help the old lady as well, because now doctor wants her to go home, but doctor does not live with her. See? So you have to arrange that as well, other than GP. Did you mention all the risk factors, like alarming signs that you have already told? Did you tell? I'm asking you.
And like increase the shortness of breath, increase the
Yeah,
swelling,
yeah,
and
yeah, yeah.
and patient is feeling unwell.
Good. Yes. Amar, and here is your question. Right. So if you have read and understood, considering a history taking station, kindly begin.
So hi, my name is Dr. Asim. I'm one of the surgical doctors. So I'm here to talk to you about your condition. So can you please tell me how are you feeling recently?
Who are you? I don't want to talk to you, doctor.
See, I am a surgical doctor and I'm here to discuss with you about your condition. I'm here to help you. So please try to be a bit cooperative and let me help you. So,
Okay,
okay.
go ahead.
So can you please tell me how are you feeling today?
Um, I'm not in good mood these days.
Can you please tell me why is that?
Don't know, but I'm not feeling good.
So, can you please tell me in the recent days how was your mood? Have you felt like you are depressed or something like that?
Yeah, I felt depressed and I was tired also.
Okay. So, can you please tell me a little bit about your sleep cycle? That
Yeah,
how your
yeah,
sleeping pattern?
yeah, doctor. I am not able to sleep. And there are so many. I have to wake up at the night also. Then I am not able to sleep again. I'm encountering this for last many years now. But
Okay.
these days, these episodes are increased.
So, have you ever felt like you even find difficulty with getting to sleep also?
Yeah, it takes me a
You said-
lot time when I enter the sleep cycle.
Okay. And you also said that when you wake up and it's difficult for you to get back to sleep also.
Yeah,
Can you please tell me about your mood also? Does it vary throughout the day?
yeah, doctor, I told you I don't feel good these days.
Okay. So is there any particular time of the day during which you feel like your mood is very worse?
No, doctor. I'm very sad these days. I'm very tired, sad.
I understand. I appreciate your concern. So can you please tell me how is your appetite these days?
Doctor, I am not interested in eating. I am not interested in grooming up.
Okay. So what do you normally eat during a day?
Sorry, doctor.
What do you usually eat during a day?
I normally take sandwich, burger. That's my diet.
So you are eating less these days.
Yeah, I don't want to eat. I feel like I lost interest in eating.
Okay. So is there any change in your libido also?
Yeah, yeah, I felt like that. Yeah, I lost the sexual drive too.
Okay. So have you ever felt like this before?
No, doctor, not like that.
So do you visit your GP for anything apart from this?
Uh, yeah, I actually took over the counter medicine, and my GP also prescribed me some medication for my blood pressure and all.
So are you taking those medications regularly?
Yeah, I took that medicine.
Okay. So have you ever had any counseling sessions with in the past?
No, I hadn't taken any counseling sessions.
Okay. So have you ever admitted to the hospital?
Yeah, you have seen in my records. You must have seen my records.
I'm looking at them now. Mm, Thank you so much. That completes the examination.
Thank you.
The history. Thank you.
Okay, so you're done. So can you please summarize
Yes,
your
ma'am.
history taking for me? You still had 1 minute left. Can you summarize, please?
So I had a pleasure of talking to the 67-year-old male.
Yes.
He presented with the low mood, and his sleep cycle is disturbed, and his mood is low throughout the day, and it doesn't vary, and his appetite is also decreased, and he also said that he noticed change in his libido as well, and even in the past he had multiple admissions. So he most probably
So what are your
suffering
differential?
from
Yes.
depression.
What are your differential diagnosis?
The most probable differential will be depression.
Okay. And this is the
Apart
provisional
from,
diagnosis.
from
What else could it be? Could be bipolar, depression episode of bipolar.
yes,
Okay.
ma'am,
And what else? Okay. How do you plan to manage this patient?
So I'll involve a multidisciplinary team for the management of this patient.
Yes.
So if the depression is mild, I'll advise him for regular exercises
Yes.
to maintain sleep hygiene,
Yes.
and a psychological session which including cognitive behavior therapy.
Very good.
So
And if it's moderate?
and if With moderate,
to severe?
the
Yes.
same will be regular exercises, sleep hygiene, and also medication, including SSRIs and
Very good.
high intensity cognitive behavioral therapy. And if I find the patient is at high risk to harm others, so I'd advise admission in the psychiatric ward.
All right. So can you tell me about the medical act? What is mental health act?
So the same I told, if the patient is in a high risk, so admit the patient in a hospital.
Okay, good. Thanks. Right. So if you have read and understood, considering a surgical anatomy station, kindly tell me if you can identify these vertebrae, and if you can tell me the difference between the right and the left.
Yes.
Yes, please.
Ma'am, the lumbar and the
Right hand side and the left hand
and
side.
the
Which
right
one are you
looks
telling
like
me?
we ma'am, I was talking about the right hand side. Right hand side is
Yes,
the
yes.
lumbar vertebra and the left hand side is the thoracic vertebra.
Okay. What are the differences between lumbar and thoracic vertebrae? How would you differentiate between these two?
Ma'am, the lumbar vertebra diamond shape, and it has the transport processes of the lumbar vertebrates and spinous process will be short and thick as compared to the thoracic vertebra. It has a facets over the body as well as the transverse processes, and the body of the triangular in shape, and the spinous processes is long, slender, and angulated downwardly.
Okay. What else is typically present on thoracic vertebrae, which is not present on the lumbar vertebrae?
Now, there will be a demi-facets on the transfer process as well as the body.
Yes, and there'll be costal facets as well in the thoracic one.
Yes, ma'am.
Okay. How, if you can please tell me, what are the parts of a vertebrae? What is this called?
Ma'am, the vertebra has a, this is ma'am superior facet, ma'am.
This one, is it facet?
This is
No?
superior facet.
Okay, what is this? This is the body.
Where your cursor,
I'm sorry, I got disconnected. Can you, I was asking about these two join and they form this. What is this?
these are the lamina. Ma'am,
Yes,
this is spinous process, ma'am. The where is your
spinous
cursor
process.
is.
Okay,
And earlier that is a lamina.
lamina. Yes, that was not the.
This is, yes,
What is these? What are these called?
this is transfer process.
Processes.
Transfer
Okay.
processes, ma'am.
Can you please tell me if you have to do the lumbar puncture? First of all, at what level can it be done?
Ma'am, lumbar puncture is done at the L4, L5 region at the supra
So-
crystal line. We
Yes.
pierce the skin, subcutaneous tissue,
Yes.
fat, fat, fascia, supraspinatus, intraspinatus, then ligamentum flavum, epidural space, dura mater, then arachnoid.
Arachnoid matter. Okay. Can you tell me about the disc, about the anatomy of the intervertebral disc? How is it formed?
Ma'am, disc is composed of two structures. Inner is
Yes.
nucleus pulposus, outer is
Yes.
fibrous layer, which is annulus fibrosis.
Fibrocritic. Yes. Okay. Can you please tell me what type of joint is formed in between two vertebrae?
It is a secondary cartilaginous joint.
Okay. What are the movements which are present in lumbar vertebrae as compared to thoracic vertebrae?
Ma'am, in the lumbar spine, we have flexion, extension, flexion, and
Lateral
extension.
flexion and axial rotation. What is different in thoracic region when you are talking about the movements?
Ma'am, in thoracic, there will be no lateral flexion. Ma'am.
Rotation, yeah. Okay. Can you please tell me what kind of vertebrae are these? Picture A, B, and C, please.
Ma'am,
If you begin with
ma'am,
A,
A is thoracic, B is also thoracic, C is cervical, ma'am.
okay. What are the differences? How would you differentiate between the cervical vertebrae and the thoracic vertebrae? Or why are these?
Ma'am, cervical vertebra
yes.
has foramen.
Yes.
Cervical vertebra has foramen transversarium. The spinous process will be bifid, and there will be a spacious canal. And in the thoracic spine, ma'am, there will be a triangular shape of the body, and there will be no foramen transversarium, and there will be a costal facets on the transverse processes.
How many cervical vertebrae are there as compared to
Ma'am, there
cervical
are
nerves?
seven.
Yes, please.
Seven, ma'am. Cervical nerves are 8, ma'am.
Okay, good. Can you please tell me why there is a different name for first and second cervical vertebrae as compared to the
Because
rest?
they are atypical vertebrae, ma'am,
Okay.
as compared to rest.
What are the atypical features that they have? Dense and
Ma'am, the first vertebra, ma'am, it is a complete ring that is atlas. It doesn't have the body. And
okay.
the second vertebra is having an extension which is called dense process. That is
Okay.
odontoid dense.
Yes. Can you please tell me what are the ligaments which are present between first and second cervical vertebrae?
And there is anterior atlantoaxial ligament, posterior atlantoaxial ligament, and there will be a transverse atlantal
Very
ligament.
good. Okay, when it comes to cervical vertebrae, which one has the spinous process that can be felt?
Ma'am, we felt the spine. C7 is the spinous process we can felt.
We can feel. Okay, why is that so?
Yes, ma'am.
Why we cannot feel the
Because it's the
remaining?
longest spinous process, ma'am.
Yes. Why we cannot feel
Because
the
they are
remaining?
short,
Yes.
short bifid, and
Attached
because
to
they
the?
are short bifid and attached to the nuchal ligament.
Very good. Okay. Can you please tell me? Right. Can you please tell me how many vertebrae that makes the whole spinal column in an adult?
33, ma'am.
Okay. Can you please tell me how many spinal nerves which come out from these?
I think, ma'am, I'll come to this question later, ma'am.
Okay. Right. Can you please tell me what are the contents of this in picture C? There is a point A. If you can tell me what passes through it.
Vertebral artery, ma'am.
Okay. What is this smaller opening? What passes through it?
Nutrient foramen.
Okay. Can you please tell me what passes through this
spinal cord, ma'am?
Spinal cord, along with, not just spinal cord, along with
its meninges, blood vessel, and as well as the arteries, anterior spinal artery, posterior spinal artery.
Okay, good. Can you please tell me what is the content of the spinal canal below lumbar 2 vertebrae?
Ma'am, there will be a cordicoina.
Correct. Very
Nerve
good.
roots.
Can you please tell me the location of the paravertebral venous plexus?
And there are 4 type of paravertebral venous plexus. One is anterior external vertebral venous plexus, which are small system around the blood vessel, around the vertebral body. There will be a posterior external around the vertebral processes. There will be an anterior internal venous plexus, which is present running throughout the vertebral canal, anterior to dura mater. There will be a posterior internal vertebral plexus, which is running behind the dura, posterior to
Very
dura.
good. Very good. Okay. One last question. Can you please tell me the contents of epidural space?
Ma'am, epidural space contains loose areolar tissue, lymphatics, fat. There will be a internal posterior venous plexus, and there will be a small arteries
Very
and
good.
nerve roots.
Very good. Good. Thank you.
Thank you, ma'am.
Thank you. Started the timer and here is your question. Right. So if you have read and understood, considering a history-taking session, kindly begin. Please begin.
Your name, age, please.
Yeah, my name is Mari. My name is Maria, and I'm 54 years.
Hi, Maria. Nice to meet you today. So how can I help you?
I'm having this back pain since 5 years.
Oh, Maria, I'm sorry to hear that. So you have back pain. Is it stay there at the moment?
Yeah, it is.
Oh,
Is there? And it's getting. No, I'm fine. Thank you.
Okay. So are you able to proceed this conversation?
Yes, we can do
All
that.
right. Okay. So now let's talk about your pain. So when did it start?
So, but for the last, yeah, and it came out suddenly while I was working in the kitchen,
Mm-hmm.
and it was fine. Thereafter, I took some medication. I went to the GP, but now I'm having this pain which is worsening and troubling.
I see. So what is the character of the pain? Is that dull, aching, or stabbing pain?
It is more of dull pain, you can see.
Mm-hmm. Is it only on your back? Does it move to any part of your body?
No, it does not. It's in the back.
Mm-hmm. So apart from the painkiller, is there anything that makes you feel better?
Yeah, taking rest usually makes it better. Working something, lifting something heavy, that makes it more worse. And moreover, my husband is disabled, so I have to lift him up in order to make up the beds and clean him up. That also makes it quite worse.
Yeah, that must be really difficult for you, Maria. All right.
Yeah,
So regarding severity, on a scale of 0 to 10, 10 mean the worst. Could you please rate this?
So in the worst of the times, it's around 7.
All right. So apart from pain, do you have any tingling or numbness or wasting of your muscles?
I don't think so. Such kind of things are there. No.
Do you have stiffness?
In the back, I have stiffness.
Tight? Any intentional weight loss?
No.
Fever? No. High temperature?
No.
Do you have any loss of sensation around your perineum? Your
No.
pelvic organ? No. Okay.
I think everything else is absolutely fine.
No. So any problem with your bowel?
No, that's normal.
And any problem with your water work?
That's also fine.
Do you notice any weakness in your legs?
No, I don't.
Did you sustain any injury to your back?
Yeah, I had episodes of fall many years ago, 10 to 15 years ago. But I think that may not be related to this because I was absolutely normal afterwards.
All right. Do you have any history of tuberculosis?
No.
Any other medical problem you are seeing your GP apart from this pain?
Yeah, I'm hypertensive and I'm taking medication for that.
Okay. Are you allergic to any medication?
No, I'm not.
Any other allergies?
No.
Have you undergone any surgery?
No, nothing was done.
Is there any similar problem in your family?
Yeah, a lot of people in my family has backaches.
Any history of cancer in your history?
No.
Okay.
No history of cancer.
All right. So let's the next question will be a little bit personal. Would that be okay for you?
Yeah, sure.
Do you smoke?
Yes, I do.
What do you smoke and how many?
Cigarettes, approximately 10 to 15 per day.
And when did you start smoking?
It's been many years now, approximately 20 to 25 years.
Okay. And do you usually drink alcohol?
Oh, yes, I drink wine.
And how many?
Shots.
Approximately 2 glasses every day.
Okay. So what do you do for a living right now?
Oh, I'm a homemaker.
Okay. Who do you live together with?
So I live with my father and my husband. So my husband is disabled, as I told you. My father is looking after.
So what do you think your problem is?
I really don't know.
Okay. What is worrying you at the moment about your condition?
The most worried about the condition of my husband right now. Handle him properly. So that is the most. That's the thing which I'm most worried about.
So can you summarize?
So, Mom, should I stop here?
Yes. Just summarize.
Sure.
I just took a history from a 54-year-old Maria who came into the hospital with back pain for 5 years, which started gradually at this dark in character, which gets worse when weightlifting, and then there's no stiffness or any other signs of any other reflex of cauda equina, and no tingling, numbness, or weakness in her legs. So, and she has a hypertension and taking drugs for that. And she drinks alcohol, and she is a smoker.
So what are your
my provisional diagnosis is I will complete the history taking and physical examination, and then my provisional diagnosis is mechanical back pain. And I will also consider ankylosing spondylitis, infectious back pain, or tuberculosis back pain, or cancer back pain.
Okay.
Yes, cauda equina syndrome.
How would you confirm your diagnosis. What investigations would you ask for?
Yeah, after the physical examination of the back and lower neurological examination of lower limb, I'll do full blood count urine creatinine liver function test, and then X-ray of the back,
Good.
including an MRI. If she has osteoporosis and suspected a fracture, I would do DEXA scan after
Yes.
X-ray.
What are the
Yeah,
management
that's
options
it.
or alternatives that you can offer to the patient? Considering it's
For the
mechanical.
mechanical,
Yes.
yeah,
Can you still
for
answer?
mechanical back pain would be painkillers, muscle relaxant, and physiotherapy.
Very good. Regular releases, yeah. What if there are red flag symptoms that the patient comes with? What would be?
It will be emergency.
Yes. Very
surgery.
good. Very good. Emergency. Very good. Thank you. Right. Feedback. What is perineum? You said any pain in perineum. What is the layman language for that?
Yeah, I don't have any idea how to use it.
Yeah. So what would be the layman language that can be used? Here is your question. So if you have read and understood, considering it history demonstration, kindly begin.
Hi, my name is Dr. Prabjit Singh, and I'm one of the surgical doctor here. May I confirm your name and age?
My name is David, doctor. I'm 50 years old.
Okay, nice to meet you, David.
Yes.
I'm going to ask you a few questions regarding the problem you are having. Are you okay with that?
Yes, doctor.
Okay. David, how can I help you?
I've been having difficulty in breathing. It's been over 4 weeks. Yeah, I also have chest problem, chest discomfort right now.
I'm so sorry to know that, David. Are you having any pain at the moment?
Yes, doctor, and I also feel difficult to breathe.
Okay, so sorry. Do you need medication right now?
Yes, please, doctor.
I'll arrange the pain medicine with the nursing staff. Are you okay to carry on with the questions?
Yes,
Okay,
you can
okay.
ask me.
Could you tell me a little bit more about your problem? How did it start?
It started suddenly. There's been a breathing problem has been over 4 weeks, and now the chest pain started now. It's real pain, doctor.
I'm really sorry to know that. Okay, and tell me, where is the pain? Could you point at the place of the pain?
It's on the right side of the
On the right side of your chest?
Yeah.
Okay.
Yes.
Okay. Could you describe the pain? What type of pain is it?
Something is stabbing me.
A stabbing kind of pain. Is it going anywhere?
No, it's just
Or is
there.
it? Okay. Do you feel that the pain increase by taking deep breaths?
No.
Okay. And is there anything which makes the pain worse or relieves this pain?
When I walk, it gets worse.
Okay. Then it increases. Anything which reduces this pain?
When I take a rest, it gets a little bit better, but it's still there.
Okay. And on a scale of 1 to 10, could you describe the pain? If the 10 is the severest pain you ever had and 1 is the mildest pain?
It's like 9.
I'm so sorry. That's quite a lot of pain. Okay, tell me more. Was there any surgery conducted on you lately?
Actually, 5 months ago, there was an unprovoked pulmonary embolism, intermediate, and for that reason, I'm on 5 months.
Are you taking the medication regularly for that?
Yes, still there. I'm still taking it.
Okay. Do you feel feverish?
No.
Okay. Did you travel anywhere recently, out of the country, basically?
No, doctor. And I also cough. When I cough, I see blood. It's like red, very, very red.
Okay. Could you describe the amount of the blood?
I don't really know, but every time I cough, there's blood.
Okay. And how many episodes of this blood with the cough you had?
It's been about 4 or 5 times from last night.
Okay. That I understand that must be scary to see that. And
Yeah.
could you also describe how many, when did it happen for the first time? What was the first time you see this blood
Pardon?
in the cough? When did you see the blood in cough for the first time?
Last night. Yeah.
And since then you had 4 episodes?
Yeah, 5 episodes. Yeah.
5 episodes. Okay. So sorry to know that. Okay. And did you have any weight loss or loss of appetite?
No.
Nothing like that. Or any pain in your arm on the left side
No.
or your back?
No.
How could I ask you how many pillows you take while sleeping?
No, just 1 pillow.
Okay. I'm going to ask you questions regarding your past history. Apart from this pulmonary embolism, as you explained, anything else you are seeing GP for?
I have hypertension, also coronary artery. Sorry. Wait.
Okay, are you taking any medication for that?
COPD. I have COPD. And
are you taking any medication for COPD?
No, not
Okay.
right now. Yeah.
Okay. Do you have any known drug allergy?
No, doctor.
Anyone in your family has similar kind of problem or any history of cancer or tuberculosis?
No.
Any heart problem in your family?
No, doctor.
Okay. So I'm going to ask you a few personal questions if that is okay with you.
Yes.
Okay. What do you do for a living?
I'm a teacher.
And whom at home?
With my children.
Okay. Do you drink or do you smoke?
I smoke like 5 cigarettes a day, and I've been smoking since I was 20. Now I'm 50.
Okay. And do you drink?
I don't drink. No.
Okay. And could you tell me what do you think is the cause of this problem?
I don't know. Maybe I'm having the same problem like I had 5 months ago.
Okay. And what is your main concern and expectation from us today?
I don't die, doctor. Please take care of me.
Good.
Yeah,
Can you
sure. We'll do that.
summarize
Thank
your
you so much.
history?
Yes.
Please.
Thank you so much, Maria. Thank you so much for telling the answers. So I took history from this 50-year-old male, known COPD, and
Yes.
the patient presented with the central right-sided chest pain.
Yes.
Since last night. The patient has history of dyspnea for 4 weeks. There is no history of increased pain with deep breathing, and there is also no history which is relevant to myocardial infarction or any chest respiratory cancers, and there is no history of fever. So my main diagnosis from this is probably the patient is having pulmonary embolism.
Okay. What
And
are
my
the
other
differential-
differentials could
yes.
be myocardial infarction,
Yes.
chest infection, and bronchial or lung cancer.
Okay, good. How would you confirm your diagnosis?
First, I will go for a complete examination, respiratory and cardiac examination of the patient.
Yes.
And I'll investigate with the ABG, chest X-ray, ECG.
Yes.
I will also get the D-dimers and ventilation perfusion scans. and the CT pulmonary angiography to rule out
Very
pulmonary
good.
embolism.
Okay. What are the treatment options that you can offer to this patient?
In a patient of pulmonary embolism, usually we have to divide the patients on a stable and unstable patient. In a stable patient with a small pulmonary embolus, we can start heparin according to the weight and targeted doses. In an unstable patient and with a large pulmonary embolus, we have to think of thrombolysis or embolectomy.
Good. Considering that this patient is having pain or chest pain even on rest, how would you categorize the need for management for this patient?
It needs emergency medication,
Very good. So
emergency management with the
So
CRISP
you'll do-
protocol.
Very good.
Yes.
This is what I wanted to hear. So this is important to have to keep in your mind. Very good. Excellent.
Thank you.
Thank you. More